I am surprised of how many people don't know about the Janus case. The Janus case is a case that's going to be put in front of the Supreme Court.
If it's a victory for Janus, it's going to hurt the whole healthcare industry.
We have a broken healthcare system in the United States where healthcare is driven by profit, by money, and not by human need, and it should be for human need.
Nurses, by their very nature, we follow the human model of patient care, which means that the focus is the patient for the better outcomes of that patient, not for the profit margin.
There's always going to be an ethical conflict there, because what's best for a patient isn't necessarily what's cheapest.
When they try to cut back, we fight back.
Advocating for a patient is one of the core functions of nursing.
But you cannot advocate if you don't feel safe in your job. And that's where unions come, because unions provide you that safe platform from which you can advocate.
We always have to stand up for patients, especially with the insurance, the managed care. They have these guidelines that this diagnosis maybe 1 or 2 days. And then with the union, we said, no, this patient's not ready for discharge yet. The union gave us the courage to do that.
The union has your back.
In non-union facilities, when you're insubordinate, you're fired at will.
In a non-union hospital, they don't have to justify it.
The conditions are just deplorable. They have no ratios.
Ratios is how many patients that you can assign to the nurses at one time.
And that is huge for safety.
The management will try to get away with as few nurses on a floor to take care of as many patients as possible.
If you're severely understaffed, it is like being in an emergency situation every day, even if you're not in the emergency room.
If you're tired, if you're hungry, if you have to urinate, if you have the sensation to have to go, those are distractions that you do not want when you're taking care of a patient.
You can miss, vital, critical orders.
The less patients a nurse actually has, the better kind of care each patient can receive, and the less fatalities can actually result, studies have shown.
And I'm afraid once this decision is passed, that our ratios will increase where we would not have the union in place to advocate for safe staffing.
It's really about union busting.
It really is a decision to take away the revenues from the unions so they will not have enough resources to fight unjust laws.
I think that advocacy is more important now than ever.
We are much stronger together than we are divided, so we need as many people in the union as we possibly can.
And like Dr. Martin Luther King said, all of us, we either go up together or we all going down together.